Myself, Zubair from group 3 to 4. My another topic is topic number 2.2.1, that is pressure in the cardiovascular system. In cardiovascular system comprises of heart and blood vessels. There are essentially two circuits in the cardiovascular system. The systemic circuit carries oxygen rich blood is the major organs, tissue, etc., and the return oxygen depleted blood to the heart. The pulmonary circuit carries oxygen depleted blood to the lungs to be recharged and return oxygen rich blood in the heart. The pressure in each of the two circuits is not constant. It varies with the time, it varies with the position, temporal or septal variations. The pressure is generated by the muscular action of the heart and is used to overcome viscous and other resistive force as it derives the blood around the body. During systole, the muscle of the heart contracts and blood is ejected into the aorta and pulmonary trunk. During diastole, the muscles of the heart relaxes and heart is filled with the blood. The pressure distribution in the cardiovascular system is governed by the equation of fluid dynamics, and later in this chapter we shall be looking the variation in more detail. For now, a qualitative description of pressure variation will suffice. The septal variations of pressure is a decrease along the arteries and veins as blood flow away from the heart. The pressure is used to overcome the viscosity of the blood. All of the branches or orifice is in the circulatory system causes further decrease in the pressure. We will soon learn how to quantify these losses, how to quantify these losses. A position close to the heart, there is a substantial temporal variation of pressure as the heart beats. The temporal variation of pressure decreases at increasing distance from the heart, so that by the time the blood reaches the smaller vessels, there is very little pulsatile. The damping of the pulsatile is attributable to the elasticity of the walls of the vessels in the cardiovascular system. In a table, it's written that the arterial blood pressure systolic is 100 to 140, capillary is 30, venous blood is 3 to 7 mmHg, cerebral spinal fluid 5 to 12, gastrointestinal pressure 10 to 20, blood pressure bladder pressure 5 to 30. Different types of pressures are there. In bladder pressure is 5 to 30, lung pressure 2 to 3 times, intrathoracic cavity pressure, joints in skeletal system up to 10,000 foot pressure, middle ear pressure less than 1 mmHg. These are the different pressures present in our body at different places. The blood pressure of the patient is used to a routine clinical measure of health. The pressure is often measured using a device called a sphygmomanometer. A standard procedure for use this device is outlined below. Place a cuff around the upper arm. Rest arm on flat surface just below the heart level. Place stethoscope on hollow of elbow or brachial artery. Inflate cuff to a pressure at which the blood does not flow, usually about 180 mmHg is sufficient. Release pressure slowly until sound of blood scooting through a restricted artery are heard. These sounds are called as Coriot, cough or K sounds. This is systolic pressure. Corot, cough or K sound. Continue to release pressure until no further sound is heard. This is diastolic pressure. We will return all these subjects of blood pressure and particular how to measure in another chapters in detail. Thank you. This is all from this topic. Thank you. Have a nice day.